Hello, everyone. I am Philip Osteen, Dean of the University of Utah College of Social Work. My pronouns are he, him. It's my pleasure to welcome you to this webinar event as we begin to wrap up the College of Social Work's Pride Week. We wanted this week to elevate the visibility of and support for our diverse LGBTQIA2S community. The mission of social work profession is rooted in a set of core values, and these core values, embraced by social workers throughout our profession's history, are the foundation of social work's unique purpose and perspective. They include service, social justice, dignity and worth of the person, the importance of human relationships, integrity, and competence. Today's event is one way the College of Social Work can uphold our values and ethics and provide the opportunity for others to think about the role of social work in working with LGBTQ IA2S plus clients, individuals, families, and communities, and to engage in the power of interdisciplinary collaboration towards a common goal. We are grateful that you've made time to join us live today or to watch the recording at a later time. I also want to sincerely thank everyone who donated while registering. These donations will support our B.W. Bastian Foundation student scholarships that diversify community care. These scholarships benefit students who plan to work with LGBTQ2S plus clients, organizations, and communities. We're extremely grateful for your generosity. Before we get to today's presentation, on behalf of the College of Social Work, I want to acknowledge that this land, which is named for the Ute tribe, is the traditional and ancestral homeland of the Shoshone, Paiute, Goshute, and Ute tribes. The University of Utah recognizes and respects the endearing relationships that exist between many indigenous peoples in their traditional homelands. We respect the sovereign relationship between tribes, states, and the federal government, and we affirm the University of Utah's commitment to a partnership with Native nations and urban Indian communities through research, education, and community outreach activities. Today, we are proud to welcome Dr. Lacey Bagley, who will talk about the role of a psychotherapist in supporting clients seeking gender-affirming care. Dr. Bagley is the owner of Celebrate Therapy, a mental health clinic serving LGBTQIA2S plus individuals, couples, polyamorous networks, and families across the lifespan. She's an adjunct professor at Utah Valley University, teaching a section of the practicum course for master's level students in the Marriage and Family Therapy program. Additionally, she serves as an advisory board member for the Out Foundation and as a board member for Affirming, LGBTQ Mormons, Families, and Friends. Following her presentation, Dr. Bagley will have about 15 minutes to respond to audience questions, so please use the Q&A button at the bottom of your Zoom window to submit any questions that you might have. And with that, Dr. Bagley, the virtual stage is yours. Thank you.
Thank you so much for that introduction. I'm also going to go through unique parts of my identity in my About Me section. So this is me. Nice to meet you all. Thank you all for being here today. I really appreciate it. I am a licensed marriage and family therapist in the state of Utah and received my PhD in 2021 from BYU and my master's from the University of Southern Mississippi. We mentioned some of my professional positions, and I want to note that I'm not speaking on behalf of any of these organizations other than Celebrate. I think I could speak on behalf of the organization I own. For those who don't know what the Out Foundation is a group of queer BYU alum who come together to support BYU students who are LGBTQIA+, needing both mentorship as well as maybe financial assistance, assistance with transferring out of the university if that's needed. And then we also provide an ombudsman if they're called into the honor code office and need a representative to sit with them and advocate for them in that space. I do want to mention my privileges today. I am cisgender, white, English speaking, and English is my native language, mostly able-bodied, highly educated, middle class. I was raised Christian and Mormon specifically, which is important living in Utah. I'm employed and I'm in a heterosexual marriage. Some of my oppressive or identities that are oppressed is that I'm bisexual and polyamorous, and that can get complicated when it comes to my upbringing and relationships with my family, both my own and then my in-laws. So I know the pain that is felt in this community. I felt it myself. All right, today we're going to set the stage by building a container. One of the containers I like to build is this deliberate practice space. And you may hear my mouse clicking around because I'm keeping open the Q&A. Maybe I'll bring that down for now, the Q&A chat. Here we go. So the deliberate practice model and idea is that we're going to explore some tasks beyond your current level of competence. So for some of you, today's information may be a real stretch in what you know professionally and just with your educational backgrounds. So I'm going to invite you to step outside of your comfort zone. Often we'll set the stage in a container that this is not a safe space. Safe is kind of like the word nice, where we're just going to keep the water calm. Instead, this is a brave space. So this is a space where I invite you to ask really difficult questions, because I would rather you ask questions here than when you're sitting with the client or working with the client in the spaces that you'll be in professionally. This is the time and space to ask those hard questions so that when you're in those spaces, you're not discriminating against those clients. So I'm asking you to have this willingness to outgrow yourself, your current bubble of safety, and gain mindfulness in this process. I learned this model in my first master's degree. When I was first pursuing a master's, I studied child family life education, and they call this the zone of proximal development. And so I was able to find one that fits with deliberate practice to say, we're in our comfort zone. We feel safe and in control in this space. And when we're in the fear zone, we're kind of finding excuses, lacking self-confidence when it comes to talking about some of the topics we're bringing up today, namely transgender health. And then we want to stretch into the learning zone and eventually the growth zone. So you see that comfort zone can become quite a bit bigger as we head into the growth zone, finding purpose, living dreams, setting new goals, and conquering objectives. This is a space that I'm currently in, I feel like, when it comes to understanding transgender health and the needs of the transgender community. I've stepped outside of my comfort zone to be curious and to listen and to actively listen, which fit in with mindfulness. We need to grow, and I'm asking you to grow today. With that said, an important part of the zone of proximal development, or the ZPD, is providing a scaffolding for people to be able to grow. So I'm not asking for you to do this alone. I'll be with you every step of the way. Okay, some important items that we need to bring up at the top are also going to be ethics and laws. I'm going to go through this part pretty quickly so we can get to the bulk of the presentation, which is letter writing. But I want to note that all of our professional responsibilities include a piece of client advocacy, that it's our responsibility to stay informed on laws and policies, to provide a safe space to help our clients process feelings surrounding laws and policies, as well as ourselves professionally, validate our clients' experiences with their identity, and inform them of their resources. And so I'm going to start again by providing some of that scaffolding. If you are unaware of some of the laws and the policies in this area, now you'll be more informed and then can help work with the people in your community better. So for those who follow along with Erin Reed, she does a wonderful job providing information on the current up-to-date laws across the United States. You can find her, she has a blog called Erin in the Morning. I think she also has a Substack, and I think it's just under Erin Reed. But if you'll notice, Utah is in this dark red space, showing that we have a lot of bans that have been passed in the United States, and I bring up a couple today. So some that you need to know about are SB 16, which was effective last January in 2023. It bans the medical treatment for individuals under the age of 18 who have been diagnosed with gender dysphoria. So last year when this ban was coming on board, we made sure to check in with all of our clientele, making sure that they had the diagnosis of gender dysphoria before the law was passed so that they can receive adequate medical treatment. And then SB 100 was effective in February, prohibiting school districts from changing the identity of students' gender without permission from their parents. This one has been kind of up and down throughout this last legislative session. And we're finding a way for students who feel safe in their peer groups to be able to express their gender identity in a healthy and developmentally appropriate way. While they explore that, being sure to involve the parents as they feel safe to. And that gets tricky when they want to be called a different name or use different pronouns at school than they do from home. HB 257 is the recent one that came out with this legislative session, and it's called the bathroom ban based on sex. And what that means is that in certain facilities, mostly public, at the state, in state buildings or public universities, there is a ban based on sex. So they ask that you use the bathroom associated with the gender that you were assigned at birth or the sex you were assigned at birth, not the gender that you identify as or your current gender identity and expression. Okay, looking up the ethical NSW guidelines. For MFTs, our guideline is 1.1, discrimination, and it's very similar to this, but I wanted to bring up the NSW one since this is for social work. So this says that y'all, and I'm going to just include me, I also don't discriminate on the basis of race, ethnicity, national origin, color, sex, sexual orientation, gender identity or expression, age, marital status, political belief, religion, immigration status, or mental or physical ability. The ones we're going to focus on today are gender identity and expression, as well as sex. We do not discriminate. When a client says my gender identity is female or male or non-binary, we get to just listen and say, thank you for letting me know. What pronouns would you like me to use? Right? We get to step into that brave space with them. Also important to note is that we live in a state that has a predominant culture and religion. And so I am going to pull today from the LDS General Handbook, noting maybe some of the differences between our professional ethics as well as some religious morals that people may hold. And this would be across the United States, wherever you live. I grew up in northern Minnesota. That's where you'll catch the long O's from me from time to time. And I lived in the South for almost 10 years, both in Oklahoma and Mississippi. And that's where you'll catch the y'all. Pick that up from there. And so when I lived in Minnesota, the predominant religion is Lutheran. And when I lived in Mississippi and Oklahoma, the predominant religion was Baptist. And so I've had to accommodate learning those cultures as someone who grew up LDS Mormon. And so now living in Utah, we're going to speak directly to the predominant culture and religion here. And so I'd ask you to do that wherever you live, wherever you move to. You can read their handbooks and texts. For example, we have the handbook provided by the LDS Church, looking at sections on LGBTQIA+ topics. It's important to understand the experience of those within these cultures and religions. For example, you could listen to Mormon Stories podcast on transgender experiences. There's also Listen, Learn, and Love with Richard Ostler. There's also Lift and Love, and a variety of other podcasts in this area where you can listen to understand how this intersectionality of gender identity, sex, and religion may impact someone. And then recognize that there may be varying viewpoints within a family. As a family therapist, it's really important for me to understand the viewpoints of every member in the family so that I can understand how the system is functioning and where we can impact change. So, for example, the LDS General Handbook has this section 38 that says church leaders counsel against elective medical or surgical intervention for the purpose of attempting to transition to the opposite gender of a person's biological sex at birth, or in quotes, sex reassignment. Leaders advise that taking these actions will be cause for church membership restrictions. Leaders also counsel against social transitioning. A social transition includes changing dress or grooming, or changing a name or pronouns to present oneself as other than his or her biological sex at birth. Leaders advise that those who socially transition will experience some church membership restrictions for the duration of this transition. And so you can imagine it would be important as a social worker to understand that this is part of the predominant culture and religion in this area and how that may impact people you're working with who are identified as transgender or who are transgender. And note that each person's experience with their gender identity is unique and personal. I often will share just a little bit about my experience as I identify as cisgender, Oftentimes I get misread a lot because I dress really androgynously. And so my gender identity up here, for those who maybe know the genderbread person or the gender unicorn, we talk about the sex assigned at birth. For example, I was assigned female at birth. Up here in my brain, I identify myself as a woman. As I move through the world, that identity is really congruent for me. I love divine femininity and the divine feminine. I love womanhood and sisterhood. Those things are really meaningful to me. But my gender expression is quite androgynous. So it'll ebb and flow between feminine and masculine. And so I sometimes get misread as someone who is more gender expansive. And so I use this opportunity then to talk about gender identity and expression with people. And so every client and every person that you interact with will have their own experience with sex and gender identity and expression, and it'll be important for us to be curious and ask about it. All right, we're going to head into some of the bulk of what I want to talk about today, which is letter writing. It's one of my absolute favorite things to do for clients who are seeking medical and surgical transition. And we'll get into the details of that. But again, I want you to think about these perspectives that everyone's experience with gender is different. Acknowledge power and privilege differentials, right? As a cisgender woman, I get to move through the world with a lot of privilege. You can understand the difficulty in clients sharing their experiences. So they may not feel comfortable right away to be super upfront with you about the nuance in their gender identity. And it's up to us to build a safe space for them to be able to broach that topic. It's also our responsibility to avoid gatekeeping, which is why we'll talk about letter writing today and how important it is in seeking gender affirming care. And then to use the client's language. If the client would like to use neopronouns like Z and Zer, it would be appropriate for you to follow their guidance. I share on the screen an image called the Gender Identity Map from the Trevor Project's Coming Out Handbook. If you are new to the space of sexuality and gender identity, this is a wonderful handbook. It's free at the Trevor Project at their website, and you can download the PDF. And I'll often bring it into the spaces where I'm working with clients and families to help guide our conversations. And one of the things I love about how they portray gender and sexuality is that they don't put it on a like a linear scale. They make it more this very beautiful constellation of experiences, where maybe in the center someone isn't quite as vibrant when it comes to gender. It's not important to them. They may feel genderless or not identify with any gender and call that agender. Whereas as we move outward, you can see that there is quite a bit of vibrance, and someone may be really reclaiming their like womanhood in a really feminine way, or their masculinity, or being in this non-binary space, neither male or female, or both. And we just get to be, again, curious and bring this diagram into a session or into a client meeting and say, where would you put yourself right now? And has there been a time where you've been in a different space on this map? Today, I'm going to be using the bulk of information on gender writing and on the criteria for gender writing from the WPATH Standards of Care. In 2023, they came out with version 8, and I am a huge fan because they include a little bit more information about fertility and the impact on reproduction when it comes to transitioning medically, as well as they include the new term eunuch, which we're seeing more and more socially, people who are assigned male at birth, who are not wanting their testicles anymore and are maybe wanting to keep their penis and have a vaginal cavity. And so someone who wants to be in this maybe both and space. The standards of care are based on the best available science and expert professional consensus. So doctors, psychologists, social workers all come together and do advanced research to come up with the best practices or standards of care when working with transgender and gender diverse people. And it is our ethical responsibility to learn and understand what these are, especially when we're uniquely working with this population. We're not just flying off the seat of our pants or off the cuff. We want to be informed about the current research. And if you look in the chat, Danielle has done a really good job to include where you can find the standards of care online. The standards of care focus on physical health, psychological well-being, and self-fulfillment. And so if you're looking specifically for like, well, what do I need to know as a mental health practitioner? They have a section on that. So for example, when it comes to gender affirming treatments, they'll let you know, like, here are the criteria for it. Again, I have a lot to cover, so I am moving pretty fast. This is going to be recorded and the slides will be made available to you. So kind of sit and soak this in and know that if you want to dive into it again, you're welcome to. The requirements for gender affirming treatment based on the WPATH standards of care is that there's a persistent, well-documented diagnosis of gender dysphoria. The individual has the capacity to make a full informed decision and to consent for treatment. And typically that goes along with the next one, be of the age of the majority in the country of surgery. For us, that would be 18. And then follow the standards of care rules for adolescents or minors. We're looking for someone who is experiencing significant medical or mental health concerns. If present, they must be reasonably well controlled at the time of surgery. So we want to assess for suicidality, self-harm, and that interaction with gender dysphoria. Or is it coming from maybe a different mental health diagnoses that we need to understand and get treated first before we seek treatment? And just know that the criteria ranges for specific treatments. So some surgeries or insurance companies or surgeons may require different periods of time for hormone therapy or psychotherapy prior to surgery. Currently in Utah anyway, for someone who wants to retransition, who's maybe already had gender affirming treatment and is looking to retransition again, that waiting time is about a year meeting with a psychotherapist. And no, gender affirming care comes in a variety of modalities. Letters provide access to these. And this is the bridge I want to make today. Here's a great spread or layout of what I'm talking about. So when it comes to legal changes, you may need to provide a letter to the judge, which I've had to do for name changes and sex, gender marker changes on documents. Socially, you typically wouldn't need to provide a letter for any social changes, unless maybe they're needing extra support in a classroom where they're being bullied or something like that. Medically, you wouldn't necessarily need to provide a letter for hair removal, but you may need to for hormone therapy. And then surgically, 99 to 100% of the time, you're going to need to provide a letter for this saying you have assessed the client and that they are prepared to receive this care. They understand, and we'll get into the minutia of this, but they understand what they're getting themselves into and are competent and able to make that decision. So I want you to glance over this so that you're aware that when we talk about gender affirming care, we're talking about all four of these different types of care. And then we could add in a fifth one, which is none of these changes. Someone may identify as transgender and not want to seek gender affirming care in any of these ways at all. So some examples of gender affirming letters. We're talking about ones that we would address specifically to the doctor or surgeon. And that would be, for example, with HRT or with surgery, and or addressed to the court, right? Like legal name change or legal sex change or gender marker changes on documents. Areas to assess. So let's start with, okay, a client comes to you, or I'll get an email that says, hey, I'm a client, transgender client seeking gender affirming care. I'm looking to have top surgery where I want a breast augmentation or to remove like the breast tissue from my chest. And can you help provide a letter saying I'm like of sound mind and can do this? And so these are the criteria that we want to be assessing for. First and foremost, we need to know, do they have a doctor or surgeon's name? A lot of transgender clients right now are under the assumption that they just need a letter because sometime they will want care. And so they'll just come in and saying, well, I identify as transgender now. I think I need a letter. And I'll let them know, like, well, are you seeking surgical or medical treatment? And they'll say, no. I'll say, then you don't need a letter. You don't need a letter just to exist. A letter helps you access gender affirming care. They'll need the gender dysphoria diagnosis, so you can look at the DSM under their criteria and assess to see if they meet that diagnosis. You want to get a mental health history. What is their experience with anxiety and depression? What is their experience with suicidality and self-harm? And then drug use is also included in there. So what is their experience with drug or alcohol or substance use and abuse? That's going to be just like you would assess almost any client that's coming in for a session for therapy, or when you're working with them one-on-one in maybe a case management situation. Typically, you're going to be required to be a licensed therapist in the state of Utah to provide this, or have a supervisor working over you in order to provide these letters. 3 more things that will be included in this letter, and we're going to go over each section today. So don't feel like you have to rush and write this down. I'll go into each one of these in depth. You'll need to know if they have post-surgery care. The surgeon is going to care that they have someone picking them up from the hospital to drive them home. You are also going to care that they have someone at the home who can take care of them while they're in recovery. For example, with top or bottom surgery, this is extensive surgeries that need weeks and weeks of recovery. You want to know, are they financially stable? Do they have a home that they can live in? Do they have access to food? And then do they have access to regular care providers? And that can be someone who lives with them, or that can be multiple friends who take shifts. We've seen it done a variety of different ways. Lastly, you're going to have a closing paragraph, and I'll share with you exactly what needs to be said in that paragraph. And it's going to share the information that they are of sound mind to make this decision. They know what surgeries they're getting themselves into and what the risks and benefits are. And then finally, your signature. And again, that's where you'll want to be a licensed professional or be working under the supervision of a licensed professional, and include both of your signatures then on that at the end of the letter. I'm going to check real quick in the chat to see if we have any questions, and then in the Q&A. Okay, no questions yet. I want this to be fairly interactive. So as we dive into now the bulk of the presentation, going into the specifics on letter writing, I would love for you to please ask any questions you have, and I'll again check in with the chat and the Q&A from time to time to be able to answer those. We have one question. So this is from Kristen. Kristen says, my practicum is at the prison, and I have a trans male client with a qualifying diagnosis and medical treatment. He wants to get top surgery as soon as he is released from prison. However, the prison will not provide a letter for him to receive top surgery, even though we're treating him. I was told the client could provide medical records in lieu of a letter. Is that true? The question is maybe. It's going to be up to the insurance provider, if the client has insurance, and or the surgeon who's going to be performing the surgery. So the client may say, I want top surgery, I need a letter, and you're going to let them know, yes, we could work to find you a provider who would be able to get you that letter, but who is the letter to? And they'll say, I don't know, I just know I need it for top surgery. And there's so much more of a process in that. You have to call a surgeon, see if they're covered under your insurance, and then set up a consultation to see if they're okay to perform the surgery. And if they are, then typically you would have a letter written to say, yes, we've done the assessment, they're prepared. Occasionally, a surgeon may want you to have that letter at the time of consultation, and so you would need to meet with them prior to. But you wouldn't need to just have an open letter to someday somebody will provide a surgery. So you want to let the client know that in due time, as you find a surgeon who's able to perform the surgery at that time, then we'd move forward into providing a letter. All right, so let's get into some of the specifics. And I have written in here some of the exact language that I use. This is from letters. I've de-identified the information and then included several different stories in here, so it's not just one person's story. Oh, I clicked one too many times. Did I go back? Sorry, y'all. Give me just a second. Let's go. There we go. Okay, here we are. No. Slideshow. Hey, okay, so first things first, we need the surgeon's name. So again, the client needs to know what surgery and what surgeon is going to be performing the surgery. This is a requirement, not a suggestion. And this was kind of loose in Standards of Care 7 with WPATH. So clients were coming in all the time saying, I need a letter, I need a letter, I need a letter. I was like, what for? And I'd be like, I don't know, eventually I got to get help. I was like, okay, let's pause for a minute and let's make sure you know exactly what you're getting yourself into and who's going to help you. In addition to this, I like to mention in this part that you're going to need a release of information from them. If they're coming into your office space, it's a confidential space, you're doing the assessment, providing the letter, that is their information, but it's confidential. And so you'll have them release the letter to themselves. And if you're going to be working in a clinical setting, most clinics have a release of information on file that you can give the client. So just ask any of your supervisors for that. Along with this introduction, you're going to introduce your credentials and or your supervisor's credentials. So you can see in here, I say, Dear Surgeon. You'd put your client's full legal name, has requested this letter in support of surgery to affirm her gender identity. So in this case, I'm using the example of someone whose gender identity is female and they're seeking an orchiectomy, which is a removal of the testicles. And I'm happy to provide this letter without reservation. Client, and this is where oftentimes I'll use their name that they go by that is consistent with their gender identity as they've shared it with me. I'll use that name in this spot. So the client signed a release of information allowing me to provide this information to you. And then this is where I have my personal information. I'm a licensed marriage and family therapist in the state of Utah, along with my license number. And I earned a PhD in marriage and family therapy from BYU in April 2021. Additionally, I have clinical training and experience working with gender diverse clientele. The mental health clinic that I own and am the clinic director for, Celebrate Therapy, specializes in providing psychotherapy to the queer community. Yours is going to read slightly different. And this is where you could spend time working in supervision to develop what would my opening paragraph be, right? What are my credentials? What are my supervisor's credentials? And what else would I say if I don't have any clinical training? You could say, I have a background in social work and have attended the training provided by Dr. Lacey Bagley. What's our date today? On April 11th, 2024. That would be an awesome end of that paragraph. And then finally, in this section is the reminder, along with the release of information, to send this as a PDF. You want to make sure that no one can change the information. So don't send this out as a Word doc. Make sure that this is a PDF so that people know that this is your words and that your words haven't been changed. All right. See a couple of things in the chat and Q&A. I'm going to just peek at for a second. Is it required to list the date of your degree? No. That's just the line that I've used in almost all the spaces I've been in. You're welcome to put it in there. The more information you can provide, the more confident the surgeon will be that the client has been assessed by someone who knows what they're talking about and has the authority to help this client seek gender affirming care. So it's not a requirement, but it is a suggestion. Okay, and then let me go in the Q&A. How are you able to assist transgender clients that have gender euphoria instead of dysphoria and would like to begin medical and or legal transition? All of our clients are going to have both euphoria and dysphoria. Dysphoria are the moments where we feel distress. So in the letter, you're going to find, and you'll see later on some of the language, do they meet criteria for having a marked distress or with some of their anatomy? We're looking for primary or secondary sex characteristics. Again, I'll get into that a little bit later. And we're looking for the moments where they experience that distress. You'll see in here moments where I share euphoria and how I write about that, especially around when they've received social support from their family or friends. So you can include parts of euphoria in here, but in order to get the diagnosis for gender dysphoria, you're going to be talking about the times when they're, again, distressed with their primary or secondary sex characteristics. And someone who's seeking surgery to remove or add different sex characteristics to their body usually has distress around what they currently are working with. And then another person asked if there's any legal issues we need to be aware of when we're writing these letters. And really, right now, it's just that, like, there isn't a law around providing the letters other than they need to be 18 years old or older, or for minors that they would have received the diagnosis of gender dysphoria before January of 2023. So I have like a client I started working with when they were very young, when they were around 8 and 9 years old. And I started working with them in October of 2022. And at that time gave them the diagnosis of gender dysphoria. So then when January 2023 hit, they had already received that diagnosis. And now they're able to still progress in seeking gender affirming care. Whereas any minors who got diagnosed after that January 2023 law was put into place wouldn't be able to receive care until they're 18 years old. So that's where the legal issues are going to be around age. And that's going to change and vary from state to state. So always be up to date. That's why I put that at the front end of this conversation. Always be up to date with what happened in the current legislative session. In Utah, that's going to be in that January timeline. What happened in January? So that we can make sure that we're following the newest laws of Utah. Okay, so part 2 is gender dysphoria. This is what we're talking about, right? So do they have a history of gender dysphoria? If someone wants to change the physical appearance of their body, they probably have distress around what their body currently looks like. So that would help meet the criteria. You can look under the DSM for that diagnosis and the criteria, and you'll describe how the client fits the criteria. For example, so here's my client conglomerate of clients. The client reported to me that she showed interest in identifying as female at a young age, but that her gender identity was not supported by her parents, specifically her dad at that time. It's okay to go into specifics. You want to show that you had a conversation with this client. You're not just giving the same letter to different people over and over and over. She reported that she continued showing interest by cross-dressing. This is the client's language, cross-dressing or wearing women's clothing. She reported that in her teens, she was not able to socially explore gender identity, or that she was able to socially explore gender identity through emo fashion, and that she felt affirmed when she was able to feminize her appearance. She reported that in her early 20s, and I didn't want to go into too many details, so you would just continue to note any important events around gender identity and exploration of gender identity. Then during this time, she met with a doctor who diagnosed her with gender dysphoria and prescribed hormone replacement therapy medications. She reported that she is now socially transitioned and she hopes to continue medically transitioning with surgical efforts. This history demonstrates that the client has adequate preparation and readiness for the surgery to affirm her gender identity. We just want to know, again, you can look at the gender dysphoria criteria to know that we need a length of time and this persistence around distress. Here we go. Here's the DSM criteria. I'm not going to name all of it because I want to give some time for Q&A and we have more to get through. But the main thing I want you to focus on is that we're looking for that marked incongruence between one's experience and expressed gender and the assigned gender or their sex assigned at birth. So that's for children. This continues with children. And so where you put this in the letter is right after that paragraph. You'll just put a small paragraph that says clinical interviews and observations confirm that the client fits the DSM criteria for gender dysphoria in adolescents and adults. And then you put the diagnostic codes in there. Here's the diagnosis or diagnostic criteria from the DSM for adolescents and adults. Same thing, that marked incongruence between their experienced and expressed genders, along with the gender they were assigned at birth or the sex they were assigned at birth. And so then same thing here. After that little diagnosis paragraph, I like to put this paragraph. Client currently reports to me that she experiences dysphoria around her primary sex characteristics. So that's going to be your genitalia. Secondary would be like your chest area. She has attempted to reduce her distress through wearing gender-affirming clothing. She insists on using female pronouns and an affirming name. Finally, she reports her primary sex characteristics cause her distress in being able to participate fully in society as her authentic gender. Having this surgery would reduce aspects of the client's dysphoria and distress and would allow her to live more fully and authentically in her gender identity. All right, the next section is the mental health history. Hopefully you have some experience with what the mental health history looks like and the assessment looks like. In a clinical interview, this is going to be pretty casual. There are assessments for mental health history, but we're just looking for a conversation about suicide attempts and ideation, risk and protective factors, and then your own clinical judgment or clinical assessment. So for example, with this client reported on her mental health history and drug abuse history. She reported that in her later teen years, she struggled with identity exploration and turned to experimenting with drugs or alcohol. She reported that this time was especially triggering for her, and she experienced suicidal ideation in the form of hoping for reincarnation because she might be able to live her next life as a female. She reported that she currently uses alcohol and nicotine in moderation. And then this is where it's really important, where you know that nicotine is really problematic when it comes to aftercare. And the surgeon will prep the client with this too. Anytime you're prepping for a surgery, this is often in there, that they ask you to quit smoking. So she's aware of the impact of nicotine on surgical outcomes and plans to stop using in preparation for the surgery. She reports that she continues to feel stress and anxiety and denies any current suicidal thoughts or plans. And we could include in there also like intent to die by suicide. She named several protective factors: being fulfilled by her job, having a good relationship with her romantic partner, and healing or healed family relationships. She is currently being treated for anxiety and stress by her psychotherapist. And you can put the therapist's name in there. You can also put and the client has committed to continue working with their therapist. So this is just a general, very brief paragraph summarizing the pertinent information from their mental health history. And then this is the post-surgery care. So we're looking for both short-term and long-term care. Are they financially stable? And what are they going to do in regard to their mental health issues, especially as they may experience some dysphoria as they get used to their new body. So client has made efforts to ensure that she will have adequate post-treatment care. She lives full-time with her partner, who will be able to care for her immediately post-surgery, as well as assist her with the healing and recovery process long-term. So that was a pretty easy one. They've got someone who lives with them who's happy to take care of them. Where that's not the case, you may want to list out the individual's names or note that they have friends and family who will take shifts caring for them. The client has adequate financial resources and has stable housing for the foreseeable future. If that's not the case, you may want to talk to the client and say, that is an important requirement in preparation for surgery. So let's make sure you have adequate financial resources and stable housing before you seek treatment. And that's based on often, again, the surgeon's requirements. The client has demonstrated healthy mental health coping skills for dealing with any dysphoria post-surgery. She reported that she is going to continue seeing her psychotherapist regularly. And then this is where you're going to include, again, a little statement about your assessment. Throughout the clinical interview, the client demonstrated linear, goal-oriented thinking, and I find her to be fully capable of consenting for treatment. Were that not the case, I would say I find the client does not demonstrate linear, goal-oriented thinking, and I find her not fully capable of consenting for treatment, right? I would also include that in the letter if it were appropriate. Finally, the closing paragraph. So you're going to summarize what you've talked about. You're going to reiterate the WPATH standards of care. And you're going to note here if the client is making an informed decision, again, if they meet that age and they're of sound mind, and then any risks and benefits that they understand there are risks and benefits to the surgery. So my example, I've reviewed the WPATH standards of care, specifically the section on tasks related to assessment and referral for mental health professionals. The client has been consistently undergoing hormone replacement therapy and has been fully and consistently living in her gender identity and role for several years. And that may be something that's like for the last 6 months or the last year, right? That'll vary per client. The client meets WPATH guidelines for medically transitioning and meets DSM-5 diagnostic criteria for gender dysphoria. The client demonstrates the ability to make an informed decision about these surgeries and is informed about the risks and benefits of this surgery. You'll want to ask, what are the risks? What are the benefits? Do you know what they are? If not, let's look them up and make sure you're informed. Client is of legal age. In this country, it's 18, and in the state, it's 18 to consent for this surgery. Her psychological symptoms appear to be stable, well controlled, and she has not reported any contraindicated factors that would prevent her from withstanding surgery. Finally, your signature, again, your clinical director's signature or your supervisor's signature as well. Some insurance companies do ask that you provide 1 or 2 signatures or 1 or 2 letters from different psychotherapists. And so you'll want to make sure to get that information from your client. Do they need 1 letter? Do they need 2 letters based on their insurance company that is going to cover the surgery, or the surgeon who's doing the surgery? What do they require? And once you find that out, you're able to help them get what they need, whether that's 1 letter from you and then another associate within the same clinic or at a different clinic. Okay, so this is what the layout looks like. It's a long letter. And this is where it's really helpful to have some sort of working letter that has been written out like this, so you can just change some of the details of it per each client. Again, you'll have access to this presentation, so consider this like your example or draft letter. You get to keep this and have this. If you ever need to reach out with me to say, hey, just checking in to see if the letter requirements have changed at all, and if you have a new draft or copy that I can borrow or have, I would be more than happy to share that with you. All right. What we're looking for is happy clients and clinician outcomes. So the client outcomes are lower rates of anxiety and depression, decrease in gender dysphoria, decrease in suicidal ideation, and hope. One of the greatest things I get to hear in this room is that my client is happy to be alive. It is the greatest gift of our life as clinicians to get to witness someone who went from every day dreading their existence to being happy to be alive and then volunteering that information. For clinicians, we're looking for an increase in capacity, that you're aligned with your professional ethics, and that you also get hope. For me, I feel competent as I've dove into presentations like this and others given by WPATH or other experts in this field. I feel, again, where my bubble of safety has grown significantly, and that helps me feel confident to say I'm also an expert in this and have helped hundreds of people receive gender affirming care. And it's aligned with my professional ethics. Again, your personal morals may be different. That's okay. You get to have personal morals, but professionally, it is our ethical duty to help clients who are marginalized individuals seek care and receive care that is fitting for them. And then hope, again, the number of times I've seen that arc, whether it happened over the course of 6 months, a year, or 5 or 6 years, I've gotten to see people move from the point where there is just like dread and hopelessness, like eking out of them, to the point where they're standing up tall and strong and proud. They've received surgery, they've made it through that dysphoria, and they get to say with so much euphoria in their voice, I am happy to be alive, and I look forward to my future. I can believe in the future that's ahead of me for the first time in my life. There's nothing that gives me like more hope in the world than experiencing that arc and that trajectory with them. Okay, so initially on Celebrate's website, we had an opportunity for them to click on the website, to reach out to a different clinician for care, at this time, you can just go ahead and email me personally. So Lacey@celebrathetherapy.org. But I'm not the only one who does this work. No, 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 no. There is a whole team of people out in the world doing this. And now you all hopefully will be able to do this too. So if you are looking for support from a supervisor who is an expert in this area, or if you're looking for maybe that second letter for a client, or just someone to read over what you've written, you can reach out to the LGBTQ Affirmative Psychotherapist Guild of Utah. It's a great organization with amazing CEUs to be part of. You can also look on WPATH's website for a provider search. We have the National Queer and Trans Therapists of Color Network. Anyone there would be happy to provide a letter and do the assessment for your client. You have Gender Affirming Letter Access Project, or GALLOP. You can also click on Psychology Today. There's a option to list gender affirming care specialists. And then as well, consider a page on your own website highlighting this specifically, that you are able to provide this to clients. I see there's another question, so I'm going to pop up in the Q&A and just peek at that. Okay. Oh, okay. So how long does it take to write each letter, and do you bill for your time? So I've gotten to the point where I've done this so many times that I can do an assessment in an hour. And so we bill for that session. And then you are able to bill for another hour that it may take to write the letter. I typically don't bill for that because I can write them pretty quickly. So it's going to be up to you and your time. If you're new at this, you may want to say, hey, let's meet one time for the assessment, and then I'm going to need to bill you for another hour while I write the letter. And in that case, you just if you met with the client on Monday for the assessment, you would put a session on your calendar for that. And then you'd say on Tuesday, I'm going to write the letter, so I'm also going to bill you for that. And you want to get client consent if that's the case. You'll want to let them know up front that's what they can expect to pay. Or if there's no fee with the service, you can let them know that too. And that's where, with GALLOP, all of us therapists on that website will do it for free. And that's our commitment to the community. That may not be the case for you. And so before you do the assessment, before you write the letter, please get your client's consent that they're okay paying for that and that they have the financial resources to be able to pay for this service. All right, then another question was, are there any support groups for partners of transgender partners having recently identified as such? Yes. There are so many support groups out there right now. Let me see. I think I have a slide at the end, so hang on to that question just a minute. I want to share this quote by Judith Butler. Let me grab a drink before I do that. It is always brave to insist on undergoing transformations that feel necessary and right, even when there are so many obstructions to doing so, including people and institutions who seek to pathologize or criminalize such important acts of self-definition. I know that for some it feels less brave than necessary, but we all have to defend those necessities that allow us to live and breathe in the way that feels right to us. Surgical intervention can be precisely what a trans person needs. It is also not always what a trans person needs. Either way, one should be free to determine the course of one's gendered life. Okay, references and then questions. Okay, so resources. I'm gonna keep this up for a minute. And also addendum, we're just in Provo now, not in Salt Lake anymore. So you can go ahead and contact me at any of these. And our location is only in Provo. Okay, so support groups. Flourish Therapy has tons of support groups for both transgender individuals and partners. Again, Lift and Love has some support groups. Mama Dragons has support groups, and that one's specifically for parents of transgender youth or transgender people. Let's see who else is. Mama Dragons also just came out with a podcast. That's great. Encircle Therapy has awesome resources when it comes to friendship circles. Progressive Paths is another gender affirming LGBTQI plus affirming clinic in Utah. they would have support groups potentially that you could reach out to. And you can reach out to them and see if they are doing support groups at this time. And then there are plenty of like Facebook groups that you could join. All right, I'm going to open the chat. And oh, great. Okay. Looks like everyone's just saying thank you. Perfect. All right, that's my time. We did it under an hour. I know, again, it was really fast. I appreciate your time and listening to me. This is a topic I care very passionately about, and you're welcome to reach out to me on my email anytime you need to. I am happy to assist people in helping the transgender community access gender affirming care.
Thank you so much, Dr. Bagley. Really incredible, as you can see from the comments you're getting. Both beneficial and I think for many people potentially transformative in the way they work with clients. So I'd also like to thank everyone who joined us today. So for attendees who are seeking continuing education hours, please watch your email in the coming days. You will get a link to the recorded presentation and a brief quiz. And once you successfully complete the quiz, a CEU certificate will be emailed to you. Thank you all for being a part of the College of Social Work's Pride Week. We are so proud to have hosted and partnered with campus allies to support multiple events that celebrate our LGBTQ2S plus community. Our steadfast goal during Pride Week and every week is to remain unwavering and undaunted in our collective goal to lift each other up. Thank you again for being a part of this really incredibly important event. And as always, be kind, be safe, and be well. Thank you, Lacey.
You're welcome.